Hey there, viewers! None of us like the taste of acid flowing back up our esophagus, and yet it happens quite often. It could be a hot dog from a local street vendor or a late-night sandwich. Next thing you know, you're burping and struggling with a burning sensation in your stomach. In today's video, we'll be talking about ways you can relieve yourself from heartburn, from antacids to H2 antagonists. Let's begin. Number 1. Bismuth subsalicylate. Heartburn happens when acid produced by your stomach reaches your esophagus. This irritates the lining of your food pipe, giving you heartburn symptoms like belching, burning, and upset stomach. When lasting a period of more than 2 weeks, this stomach acid reflux is likely to be diagnosed as gastroesophageal reflux disease, GERD. GERD causes complications like stomach ulcers, aspiration pneumonia, and esophageal strictures. It's estimated that approximately 20% of people experience heartburn once a week. To avoid heartburn, you need to watch your intake of triggering foods, which include spice, caffeine, and alcohol. In case you still end up with heartburn, bismuth subsalicylates are there to help you. Bismuth subsalicylates, also known as pink bismuth, is a medication available over the counter, OTC, under different brand names: Pepto-Bismol, Kaopectate, and Maalox Total Relief. It's commonly used for treating conditions related to your gastrointestinal tract and upset stomach, including heartburn, indigestion, diarrhea, and nausea. Bismuth subsalicylate is very effective in relieving gastrointestinal distress. It protects the lower part of your esophagus from stomach acid. Its antacid content helps decrease excess stomach acid. This eases discomfort caused by heartburn and relieves the burning pain. Bismuth subsalicylate produces anti-inflammatory and antimicrobial effects on the body. It kills and binds diarrhea-causing bacteria and helps fight against gastrointestinal infections like traveler's diarrhea. It protects stomach ulcers from further aggravation by forming a protective layer over them. It has the same impact on the delicate lining of your stomach. Another benefit of taking bismuth subsalicylate is that it has anti-nauseant and antiemetic properties that effectively prevent symptoms of nausea and emesis. It's available in the form of a chewable tablet, liquid, and caplets. But before you head over to the pharmacy, you need to know a few more important facts about bismuth subsalicylate. It can only be taken by people over the age of 16. If given to a child or teen with symptoms of fever, flu, or the chickenpox, it can lead to a serious condition. Always check with a doctor if it doesn't ease your symptoms after 2 days. Use it occasionally for heartburn, indigestion, or upset stomach. You should avoid using bismuth subsalicylate if you're allergic to aspirin or suffer from bleeding problems, diabetes, or gout. Pregnant or lactating women should consult with a doctor before taking bismuth subsalicylate. You can take it with or without food. If you're taking it for diarrhea, make sure you're drinking enough fluids to prevent dehydration. Are you enjoying this list so far? Well, this next point will surely help you. But before we continue, why not subscribe to our channel for more videos like this and hit the bell icon so you're always up to date. Number 2. Antacids. Heartburn caused by acid reflux can bring on burning pain in your lower chest and throat. If you can't get bismuth over the counter, antacids do help. They're made to reduce acidity in the stomach. Active ingredients present in these antacids neutralize the excessive acid produced in your stomach. These active ingredients are calcium, magnesium, and aluminum, which form various compounds that help neutralize your stomach acid. Each one of these cationic salts has different properties that determine their clinical use. For instance, aluminum hydroxide in antacids combines with your stomach acid to form aluminum hydrochloride and water. This results in acid neutralization. Calcium salts also neutralize gastric acidity and relieve symptoms of heartburn. Some of the popular brands are Tums, Philips Milk of Magnesia, Rolaids, and Maalox. Tums antacids contain calcium carbonate as an active ingredient, while Alka-Seltzer has sodium bicarbonate. Magnesium trisilicate, the active ingredient in Gaviscon, neutralizes the acid. If you can't take sodium or calcium bicarbonate, there's Maalox antacid with aluminum hydroxide as the key ingredient. They quickly show the impact on heartburn caused by acid reflux. You can also take over-the-counter antacids to get relief from inflammation or ulcers in the stomach, esophagus, or at the beginning of the small intestine. These antacids are available in a variety of forms like liquid, chewable tablets, and capsules. Besides taking antacids, you'll also need to curb the excessive acid production in your stomach. For this, you'll need to restrict certain foods from your diet. They stimulate acid secretion in your stomach. So try reducing your consumption of carbonated drinks, acidic juices, and chocolates, as they increase acid secretion. Some medications also increase the production of acid. Just like bismuth, you need to know a few important facts about antacids before you get them. Certain antacids need to be taken daily after meals as well as before bed. If you're taking antacids in suspension form, follow it with water. Antacids like hyperphosphatemia should only be taken for a short period of time, like 4 weeks. Overuse of antacids or ignoring the dosage recommendations will result in abnormal mineral levels in the body. People with hypertension should avoid taking sodium bicarbonate, like Alka-Seltzer. Antacids containing magnesium hydroxide may cause diarrhea, especially if you overdose on them. Similarly, aluminum hydroxide may cause constipation in some people. If you suffer from any kidney disease, avoid taking antacids with aluminum hydroxide. It leads to the formation of kidney stones, as it builds up and causes salt retention. Another thing to remember is that lower levels of stomach acid over a long period of time prevent your body from absorbing iron and other essential minerals. So instead of taking antacids every day, speak to your healthcare provider if symptoms still persist after a few weeks. Before we move ahead, here's a video you might like. Watch to learn about 10 body changes that need your immediate attention. Number 3. Antacids along with H2 antagonists. If antacids alone don't work, try a combination of antacids and H2 antagonists. Antacids along with H2 antagonists work on 2 levels. Antacids will neutralize the existing acid, while H2 antagonists reduce acid production in the stomach, keeping them low for a period of time. This combination of medications contain famotidine, which is a histamine 2 blocker. Famotidine combines with the active ingredients in the antacid. You can find this combination in Pepcid Complete. Active ingredients in H2 blockers work individually to provide you quick relief from heartburn. The effect will last 12 hours. Famotidine can be classified as a drug used to block histamine 2, H2 receptors. H2 receptors release acid in your stomach and famotidine blocks it. This process suppresses the acid secretion in your stomach and relieves heartburn. While H2 antagonists work away, the active ingredients of the antacids neutralizes acid and forms salt and water. It helps alleviate burning pain and ease symptoms of upset stomach and indigestion. If you're struggling with acid indigestion and stomach-induced heartburn, the combination of H2 blockers and antacids will certainly help you. Your acid levels will be lowered quickly, and it would stop acid indigestion from coming back. However, make sure you take only 2 tablets within 24 hours. Chew the tablet completely before swallowing. Do not continue taking the medication if symptoms don't improve, especially after 14 days. You should avoid this medication if you're allergic to acid reducers like famotidine. Foods you can add to your diet to reduce heartburn. Wondering what you can eat to help prevent acid reflux? Well, oatmeal is a great choice. Pair it up with non-citrus fruits like apples and pears. Egg whites and lean meats are helpful as well. Vegetables are low in sugar and fats. You can try potato leek soup, steamed broccoli, or green beans. Eat more cucumbers in the salad. They're great for soothing the burning sensation in your stomach. Ginger tea has anti-inflammatory properties and eases symptoms of heartburn, as well as gastrointestinal problems. And of course, bananas. They should be part of your diet if you're struggling with acid reflux. Include healthy fats like avocado, flaxseed, and olive oil into your diet. Do you get heartburn often? Have you tried any of these remedies? Let us know in the comment section below. We'd love to hear from you. Enjoyed this video? Hit like, share, and subscribe to Bestie. Wait! What kind of bestie would we be if we didn't tell you about our other awesome videos? Go ahead, choose the left or right video and enjoy.